Hi, I'm Dr. Sophie Côté, psychologist, expert in memory reconsolidation in humans and animals. And I thought it would be useful to share with you little capsules about the common questions that keep coming back in my individual and group supervisions. So let's look at the I don't know answer. Let's consider the question of one participant. When I ask my patients what the connection is between X and Y, I'm often told I don't know, no matter how I ask. Or when I point out a connection between an emotional truth and a situation, I'm politely told that it makes sense or that it's a very nice theory, but it's not a visceral felt awareness. It almost never happens the way it does in demonstrations. Okay, so firstly, the what's the connection experience in coherence therapy isn't really a question you ask. It's about setting up an experience for the person. It's sometimes important, especially at the start of therapy, to do a bit of psychoeducation and say, I'm not asking you to find the answer or to explain what's going on. We're not trying to theorize about what's going on for you. What I'm asking you to do by asking that question is to go there, stay with that, and feel what it's like for you to put X and Y side by side. For example, a person suffers from a nagging anxiety about the possibility of vomiting in public and shares that when she was young, she felt very embarrassed to walk out of the PE locker room in her underwear during a fire alarm in front of her peers. So asking her what's the connection between vomiting in public and appearing in your underwear in front of your peers at school, we simply ask her to feel the connection between the two emotional truths or the two situations and the two experiences and to let emerge um, what's the connection between them, what's the bridge, what's the common reality between them, rather than giving us a pro-symptom explanation of the connection between the two. That's not what we're expecting from that patient or what we're trying to create. The person may feel that the discomfort facet is the most salient connection for her. But she may also feel that it's the vulnerability that stands out, or some form of judgment or discomfort in the other person's view, her peers. So it's important to convey to patients that we don't assume, we don't presume they know the answer because we operate outside the field of awareness, but rather in the implicit memory, but rather that we suggest that they stay with the question for a moment, that they weigh it, that they feel it, explore it, and see if anything starts to emerge in their body, in their emotions, their thoughts, their memories, flashes, images, and so on and so forth. Some people will tend to go immediately to intellectualization and rational thought to answer this question, and they will need to be redirected to put their attention elsewhere where they're not used to looking. So rhythm and tone, as we know, are very important for experiential work. So think Shavasana, meditation teacher. So you really need to channel that when you do experiential work. It makes a difference. So slowing down and softening your tone, leaning forward, they're all little ways in which you can foster a truly inhabited experience, embodied experience. So I hope this was a little bit helpful for you. I wish you a very good practice.